So what do the candidates say about health care? Well, I think this is I looked for a summation statement from each of the candidates. This is Barack Obama's. He says, our health care system is broken, it's expensive, inefficient, and poorly adapted to an economy no longer built on lifetime employment, a system that exposes Americans to insecurity and possible destitution. Can't find much to argue with in that statement. I doubt if very many people could. I could have written that pretty much myself. How does he propose to put this into implementation? There's where the devil's in the details. His plan breaks down, I think, into three categories, if you will: mandates, subsidies, and regulation. In terms of mandates, Barack Obama does not have an individual mandate. If you go back to the primary, you'll remember this was a huge bone of contention between him and Hillary Clinton. Hillary Clinton supported an individual mandate. So did Mitt Romney on the Republican side. Had the idea of it, everybody has to buy health insurance. Barack Obama opposed that. Now, this means without an individual mandate, you will not get to universal coverage. You will not cover 100% of the population. Now, I don't believe with an individual mandate you'll get to 100% of the population. But if you don't have one, you're admitting you won't. And Barack Obama says his plan does not cover everyone. Somewhere between 2 and 15 million people would still be uninsured under his proposal. He does have two other mandates, however. He has an employer mandate. This is a mandate that says businesses must provide health insurance to their employees, or if you fail to do so, you will have to pay an extra tax that will go into a pool, and then the government will use the money in that pool to buy insurance for your employees. It's called a pay or play mandate. All businesses would be included except, his statement says, the, quote, the very smallest businesses. We don't know what the very smallest means. He's never defined that. One of his spokesmen at one time said some number fewer than 10 employees would be considered in that very smallest. But everybody over that would have to participate. He has also not said, and you recall this was in the debate last night, he has not said what the payment into that pool would be, how much you'd have to pay if you don't provide health insurance. I can tell you that similar proposals, one that was introduced in California, one that was introduced in his home state of Illinois, generally are between 4 and 7% of payroll. So it would be a 4 to 7% of wages as a tax that would have to go into that pool in there. So that's the employer mandate. He also has a mandate for parents. Parents must provide health insurance for their children. And children are generously defined as up to age 28. It's the slacker mandate. Again, how he's going to enforce this has been left up in the air. He has talked at one time or another about, for example, that you would not be able to enroll your children in school unless you provided proof of health insurance. How he's going to reach down to younger children or children in their 20s, I don't know how he plans to do that. So it's a little bit vague exactly how he's going to do that, but he does say there's going to be some sort of mandate on parents. In terms of regulation, he's got a number of proposals, regulatory proposals. The first of these is what's called community rating and guaranteed issue. Guaranteed issue means that an insurance company, if you apply for insurance, the insurance company must accept you, must sell you insurance regardless of your health, regardless of whether you're in perfect health or you're on your deathbed. They still must sell you insurance. Community rating means they must charge the same premium to everyone they sell insurance to, regardless of their health. So a 22-year-old marathon-running, non-smoking, non-drinking person in perfect health pays exactly the same premium as someone who's 82, smokes 4 packs a day, and has stage 4 cancer. They all pay the same premium. What that means, of course, is that the premium on the young, healthy person is going to go up so that you can bring down the premium on the older, sicker person. Of course, what happens when you do this? The young, healthy person says, I'm not going to pay that much. Unless I get hit by a truck, I'm not going to need health insurance, so they drop their insurance. New York State introduced community rating several years back, and the first year after that, 500,000 people dropped their health insurance. You make it even worse when you have guaranteed issue, because that says, why not drop it now? Because I can wait till I get sick and then buy it. It's sort of like after you drive your car into the tree, you can pick up the phone and say, hey, Geico. I don't know that that works too well.